they've chosen to take on as a caregiver. So I'd like to share just a couple of highlights from our annual Spotlight report. This is a research report that comes out November, December on an annual basis. This year, of course, we had to shine a spotlight on COVID-19. It was the absolute core issue, as it continues to be, for caregivers across the province. And we saw from the research data, the pandemic really amplified what was already a reality for caregiver issues related to burnout, isolation, and feeling of loneliness. And I wanted to just underscore one of the many statistics that you can find in that report on our website. 54% of caregivers say it's harder to manage their caregiving responsibilities since the pandemic began, and it's taking a toll on their mental health. So when we have half of caregivers feeling that way, that I think is cause for pause and important conversation about how to support caregivers now and in the future. And I'll underscore that this research really focuses on caregivers across the province in different caregiving contexts, caring for people with different needs and in different geographical areas, urban, rural, and across the province of Ontario. But I think these are important things to kind of anchor our conversation in, because it hopefully helps people to understand that they're a little bit less alone than they might have thought in their caregiving role. So why is caregiver voice so important? It's important that we distinguish between caregiver experience and provider experience, that we would distinguish between caregiver experience and resident experience. And it's also important that we recognize that caregivers bring valuable expertise that helps to inform the care of residents at the individual level and at the system level. So that caregiver voice is so critical, and I'm really pleased to hear that Sam will be at the table for some of the recovery planning, and that there will be caregivers at the table for those task teams that have been identified, because we heard from a number of those representatives that caregiver voice, whether it's the personal stories, whether it's the suggestions, whether it's helping people to understand the impact on caregivers and the insights that they have, that caregiver voice is critical now and as we move forward. So in terms of what the Ontario Caregiver Organization is focusing on, we have 3 key strategies related to caregiver support and engagement. First is the inclusion of caregivers as a part of the care team. This has been central to our belief from the beginning, that caregivers should be and are recognized as a part of the care team, along with all of the other professionals who are engaged in care for a resident. That caregivers need their well-being and resilience supported, and that's one of the key areas of focus that we have at the Ontario Caregiver Organization. One of the things we consistently say to caregivers is, you are here for the person that you care for, and we are here for you. So in the same way that the person that you care for may look to you for any number of physical, mental health, emotional, practical supports, we know that you may need some of those same kinds of supports as well. And that's why we exist, to support the things that you need to sustain you as a caregiver. And then also to enable that meaningful engagement of caregivers at lots of different levels, whether that's through engagement with family councils, whether that's through engagement at the provincial level, whether that's through all the different ways that we can bring caregiver voices to the table, making sure that caregivers are meaningfully engaged in that dialogue. So let's look at some of the ways that we're doing that. First and foremost, I want to identify the importance of including caregivers as partners in care. And I'm very pleased to share that there's quite strong evidence for the positive impact of caregiver presence on patient or client or resident safety. And the reason I'm grouping those things together is because the research often combines insights related to hospital patients, clients receiving care in some kind of assisted living scenario, or residents such as in long-term care. We know that it also has a positive impact on patient and caregiver experience, as well as staff morale and experience. And this is one of the things that I think hasn't received as much attention as it could have over the last year, that staff rely on caregivers to provide a wide range of supports. And so having caregivers engaged and involved in that process is really, really critical. And we know, of course, that caregivers offer a deep understanding of the resident, of their condition and ways to help providers make better care decisions. And so we see caregivers as being fundamental partners in care and a critical part of the healthcare team. So to that end, I want to introduce you to a tool that we have available that's been implemented in some instances in long-term care homes across the province in the last several months. Caregiver ID was piloted pre-pandemic in hospital settings. It provides a visual recognition of caregivers as partners in care. It formally identifies the caregiver, and it really is an important step in strengthening that relationship, working with caregivers. And so what we did as part of our pandemic response was we created the Partners in Care Pandemic Toolkit. This is a living, breathing entity, this toolkit. It started with some initial tools, such as the Caregiver ID, and it is including additional tools that have come out of our learning collaborative. And I'm pleased to share with you that we have over 24 sites across the province who have implemented Caregiver ID. And that when we started with these learning collaboratives, what we weren't sure is whether or not hospitals, long-term care, and other forms of assisted living would want to work together on this. We were prepared to work separately in those different contexts. And the participants actually came back to us and said, we'd like to work together. We'd like to cross-pollinate. We'd like to learn from each other. We'd like to see how things that work in one type of context may work in another. And so we've had this learning collaborative that's been running for many months now, and where we have participants who are implementing the tools that are available through the Partners in Care Pandemic Toolkit, and also identifying where are the gaps. And so that's why the toolkit is growing, because people are saying, we actually need more of this. We need some other information on that. We need a tool for this. And because these settings are finding that they have common needs, we can come together, we can create one resource instead of everybody reinventing the wheel on their own. So in the Partners in Care Pandemic Toolkit, we do have a focus on Caregiver ID as that central tool to support the safe presence of caregivers during COVID-19. And of course, I'll underscore that this always is designed to align with any ministry directives around the inclusion of essential family caregivers. We do work with government to bring that caregiver voice, to work with them on strategies, as I know Family Councils does as well. But we want to ensure that any tools that we provide are in alignment with the most recent direction around the inclusion of family caregivers. We know that tools like Caregiver ID can provide everyone with the reassurance that caregivers have screening, training, and permission to be there. So again, we align with the screening protocols that are in place as they continue to evolve. In terms of training, I do want to underscore that we are aware of and work with requirements such as IPAC, infection prevention and control measures. But we also want to make sure that other learning opportunities that are available to caregivers are not included as any other kind of barrier to entry to being identified as an essential family caregiver. So there are training programs that are available through the Ontario Caregiver Organization, through other organizations, but we want to make sure that those are resources that are available for caregivers to use on a self-directed basis, but that any training requirements for caregivers as far as being identified as a caregiver, that those only align with any ministry directions around what caregivers need to be aware of in order to use PPE effectively and those kinds of things without adding any extra constraints or expectations on caregivers. And then, of course, we want to ensure that any permissions are documented as it pertains to the particular caregiving relationship that a caregiver may have with the resident or the individual that they care for. So we are pleased to see that this has become an essential part of caregiver programs in hospitals, in long-term care homes, and in other settings, and that we continue to get inquiries about this. And we hope that it is a part of one of the many steps that we can take around long-term culture change, recognizing caregivers as partners in care. So if there are people who are interested in learning more, you can find out about our Partners in Care Pandemic Toolkit on our website. And of course, we can also connect you with homes who are up and running in using these in certain contexts. But I'll share just a couple of the benefits now so that you can get a bit of a gauge of why people are doing it. It means that we have that formal recognition, that we have that clarity around permission. It also helps to identify caregivers and support them if they become lost or running into any challenging situations. It also can help to empower caregivers to have that confidence to ask questions and to be recognized as that active partner in care. And I also believe that it will help to rebuild some of that trust and effective communication that we know has been really strained over the last year. This is one of the biggest topics of conversation that comes up in our work with partners related to caregiver engagement. Caregivers have shared with us some of the concerns that they had pre-pandemic about the level of engagement that they experienced. And when restrictions were implemented as a part of the pandemic, we heard from people, wow, my fears are being validated now, or how can I have the trust and information that I need under these circumstances, when in particular at the beginning there was quite a bit of confusion and can continue to be in many cases. So we see that this toolkit can help to rebuild that trust, to support the communication, and to provide some structure around how that can happen, recognizing that that's a process that happens over time. So some other resources that we have some e-learning modules, both for providers and coming soon for caregivers themselves. We have a module called Caregivers as Partners that healthcare providers can take. And we also have a specialized module on mental health and addiction. We are finalizing our module for caregivers that focuses on how they can be informed with the best information, tools, and strategies to enable them to work with all of the other healthcare team members that they might engage with. So I encourage you to check those out on our website as well. I want to talk specifically about caregiver well-being and resilience, because this has been one of the most significant areas of inquiry for us as an organization over the last year, recognizing that we support all of Ontario's caregivers regardless of their circumstance. And, you know, everyone's well-being within society has been challenged, but especially caregivers have been challenged related to visitation and access restrictions, but also access to the services that they may need for the person that they care for, and also the changes that have been occurring around restrictions and mobility and all of those kinds of things. So, you know, we want to ensure that it is consistently recognized in all contexts that caregivers play an invaluable role in our healthcare system and in our communities. So in all the places that caregivers and the people they care for show up, that they are an important part of that process. We also know that many caregivers are overwhelmed in their role. This is one of the other things that we see through the Spotlight report year over year, is whether people are new caregivers, whether they're caregivers who have been in that role for many years, whether they're navigating a transition in their caregiving role, or perhaps they're dealing with some of the ongoing challenges with COVID-19. Overwhelm is a significant issue for caregivers. And so we know that one of the things that can help with caregiver well-being and resilience is how care providers can work with and support caregivers in ensuring that quality of care for the person that they're caring for. So I want to share with you just a little bit about the resources that we have for caregivers at the Ontario Caregiver Organization. We have a 24/7 caregiver helpline, and we have a chat that's available on weekdays as well on our website. This is a great place for caregivers to go to gain information and resources about what's available in their local community. So it really is an information and referral line, and they can refer to either those hands-on supports that you might need in your community, or it could be some of the things that we have available as additional supports through the Ontario Caregiver Organization. One of our most popular programs is the SCALE program, which supports caregiver awareness, learning, and empowerment. And this program includes 3 components. We have an 8-week series of webinars that you can attend live or recorded. It includes group coaching for caregivers who would like to come and actually work with other caregivers and a professional on some of the specific issues that they're dealing with. And it also includes one-to-one counseling, all free and in English and in French, as all of our programs are available in English and French. So this has been a high demand program. We run it 3 times a year. And if this is of interest to you, I encourage you to visit our website to learn more. We also have a peer one-to-one mentoring program where we will match caregivers with other caregivers who may still be in their caregiving role or who may want to support other caregivers based on their previous lived experience as a caregiver. And so we have a matching mechanism where we help those mentors to build the relationship over time and to really follow the journey and provide ongoing support to caregivers who would benefit from or are interested in that ongoing relationship with a mentor. We have online support groups, which may move to face-to-face at a time that that's feasible, but we have those on a weekly basis that people can come and join and get support from peers who are in other caregiving roles. We have educational webinars and then many other programs and services, some of which I've mentioned here before, like our e-learning. So if any of this is of interest to you, then please visit our website at ontariocaregiver.ca. We have some great resources and toolkits, including an I Am a Caregiver Getting Started toolkit for new caregivers, a Working Caregiving, a Balancing Act toolkit for working caregivers, and lots of tip sheets related to COVID-19 and other issues as well. So we're constantly putting new resources and information on our website and also referring out to other sources of information. One of our core commitments is that we don't want to duplicate anything that's out there in the system. So if other people are already doing things or a resource already exists, then we'll point caregivers to other places where they can go and get that information. I also wanted to share the Time to Talk toolkit. And this is something that is a helpful resource for healthcare providers, and you may want to take a look at the information about this as well. There are adaptable tools for care providers that enhance support to caregivers and that support that engagement with caregivers around their well-being and their role as a caregiver. So this really underscores the importance of that communication and dialogue between healthcare providers and caregivers, and hopefully provides some useful information and structure about how to do that. Then our third strategy, as I mentioned, is really around the meaningful engagement of caregivers. We learned so much in starting up this organization from our colleagues at the Change Foundation, who taught us about co-design and who really underscored the importance of authentic engagement with caregivers. We have caregivers at the core of the development of not only our programs and services, but also the ways that we bring caregiver voice to different partners, including government. So when we share caregiver insights about experiences, about recommendations, about ways to move forward, we have caregiver voice and caregiver authentic engagement as a part of that process. And so we know that this helps with the outcomes around care experiences, strengthening those relationships with providers and patients and caregivers, and that this can actually positively impact service delivery. And so we're really pleased to work with many, many different partners, but in particular caregivers, around bringing distinction to the caregiver voice from residents. And this is, I think, one of the fundamental roles that family councils play around recognizing that caregivers need to be heard, they need to be recognized, and they need to be supported. And we're really, really pleased and proud to have an ongoing relationship with the family councils team and to find ways to work together, whether it's events like this or whether it's collaborative webinars we've done in the past, or looking at ways that we can disseminate and share information that our respective organizations have. I think that engagement of caregivers is an ongoing process, and we also want to ensure that that is recognized and implemented in lots of different ways and lots of different settings as well. So where do we go from here? So a couple of action steps. I am a big fan of reviewing what we have accomplished so far and reflecting and using those reflections as opportunities to move forward. I think when we look at some of the information that we heard earlier around the task teams that are coming up, those reflections hopefully will help to inform some of the next steps of where we go from here. I invite you to explore the tools and resources, and we're happy to share that out with family councils in case they can distribute that with you. But if any of this is of use, then I invite you to come and check it out, and then of course to engage in the conversation. I've been so pleased to see all of the dialogue and engagement that I've seen this morning as a participant. And if you would like to reach out to me, my email is on the next slide, so you can find a way for us to connect if you have other thoughts or strategies. You're welcome to connect with us, and I'll have our contact details up shortly, as I mentioned, around the implementation of any of these tools, including the Partners in Care Pandemic Toolkit. If you're interested in peer learning and support or any of our other programs, please reach out. And of course, I also invite your feedback, because if there are other ways that we can engage and help, we'd like to be able to do that too. So I'm going to open it up for questions, but I'll turn it to our contact information so that you can see our website. You can also follow us on Twitter. We're also on Facebook and Instagram. Our YouTube channel has lots of videos, including recordings of previous sessions, and you're welcome to reach out to me directly if you have any further thoughts. So Tiffany, I've seen some raised hands and other questions popping up, and I'm hoping you can help me navigate that, because I know we wanted to make sure that we had a little bit of time for dialogue and discussion today.
Hi. Yes, of course, Amy. Thank you so much. I do have to start by saying that was a great presentation. I really appreciated seeing the not just the visitor hashtag, especially because we know the year that we've had and how caregivers have felt, especially at the beginning of the pandemic with a lot of restrictions. It's great to see and see the validation for caregivers that they're not just a visitor in everything that they do for their residents, whether they're in long-term care or in the community. So I did see a couple great questions. If you wanted to even speak to the not just a visitor hashtag.
Yeah, I'd like to do that, and then maybe we can jump into some of the questions. You know, I think the pandemic has really underscored the importance of language and what that really means for people. And we're still having that conversation that caregivers are not visitors, that the words visitor and caregiver are not synonymous. And we'll keep having that conversation as long as is necessary. I think we've made some progress by recognizing that caregivers are essential, but of course, we would also like to ensure that all members of the care team, which often includes more than one caregiver, whether they are family members, friends, or neighbors, that they are recognized as a part of that care team. Certainly, I've had the privilege of being a caregiver at 3 different times in my life, and I have never been the sole caregiver. I have always been a caregiver as a part of a care team. And so finding ways to recognize that, and recognize that usually there's more than one, and that caregivers are not just there for a visit. Not that visits aren't important. I am a huge fan of visits for many different reasons, but caregiving is a different commitment that people make, and caregivers are not visitors.
I totally agree with those sentiments, and I'm glad that we're able to echo all of those messages, especially today as we talk about charting a new course and really acknowledging caregivers as care partners, because they know so much about the residents, maybe more than anyone else. So it's great that their voices are being really heard through the presentations we're hearing today. So I did have a question about your toolkits. Is there anything in the toolkits regarding activities that might be helpful for engaging residents, especially now during the pandemic?
That's a good question. That may come down the road. We don't have those kinds of resources in the toolkit at the moment. We've really focused on caregiver inclusion right now, but I know that the Learning Collaboratives have a long list of things that they'd like to work through over time, and it's possible that that will be one of the things that we see down the road, but I'll manage people's expectations by saying we don't have resources on that at the moment.
Okay, and I did see my colleague Kathleen had also mentioned a resource in the chat box as well. I do also recommend that everyone on the line hearing from Amy, that they do visit the website OntarioCaregiver.ca. There are so many insightful reports that are so well written. I especially enjoyed the last one. It talked a bit more about the mental health of caregivers, and sometimes that's not often talked about. I've spoken to a lot of dedicated dedicated caregivers who are juggling so many things, including they might have children, they might have full-time work or other things. Do you have any recommendations for how, caregivers can remember to do that self-care piece so that they don't burn out as well?
Yeah, I mean, I'll start by acknowledging that I know self-care as a term can be a controversial term for some caregivers. And I think it's controversial for a couple of different reasons. One, self-care in some people's minds has a very specific connotation. So if I take a bath or I go to a yoga class, or not that there's anything wrong with either of those things, but if only caregivers would do that, they wouldn't be stressed out, I think is kind of part of the dialogue. And if only caregivers would take better care of themselves, maybe they wouldn't face some of these challenges. And we really want to get away from that narrative, right? And so some caregivers don't like the term self-care because they feel that it places the burden back on them, right? So I really honor that perspective, and I really honor that there are different definitions of self-care and different intentions behind the meaning of that as well. But what we do know is that caregiver well-being is a critical component of sustaining yourself as a caregiver when we have so many caregivers who are being burnt out. What we also know is that the importance of connection and support cannot be underscored enough. It's the reason we have peer mentorship. It's the reason we have peer support. It's the reason why we have the coaching and the counseling available to caregivers, because caregivers were feeling isolated before the pandemic. And so now they're needing those connections even more. And especially when, caregivers who would like to perhaps be in different circumstances, they're facing that I want to be caring more and I can't. And that in and of itself places a burden and a challenge to well-being. So I would definitely say that if caregivers have any concerns about their own mental health, to not only check out the information on our website, but also to prioritize connecting with your own care providers. So, we hear this from healthcare providers that if they're seeing a patient and there's a caregiver with them and they're aware that the caregiver may be facing challenges, they may not have the time or resources to support that caregiver. And so we want to make sure that caregivers are talking to their own family doctor or specialist or whomever is surrounding them as a part of their own care team to make sure that they have the support that they need. We know caregivers face additional challenges related to depression, related to anxiety, and these are things that can require their own levels of support for the caregiver. So my number one recommendation would be please prioritize your own health and well-being, including your mental health, by connecting with your own care providers. And if you have your own inkling, or if you're receiving feedback from other people related to concerns related to your own mental health, I think it's important to prioritize addressing that so that you can continue to be the caregiver that you want to be.
Thank you so much for addressing that topic, Amy. I think it's been revealed how important mental health is, and managing that before anything escalates, especially during the year that we've had. So thank you for giving that feedback. I think it was a nice segue back to, the term of visits. We did receive a question. I'm glad I was able to check my email and grab that question, because it is a good one. Just in terms of the continuity when it comes to some of the things that we're hearing at homes regarding caregivers and their visits. So we did receive the question, this particular person, their home is limiting caregiver visits on outbreak units, and only to those providing physical care like feeding. So some of the emotional and support side of caregiver presence is not being really addressed when things like that comes up, like outbreaks. Do you have any thoughts on how maybe caregivers can navigate, not being able to see their loved one or complete those functions when there is an outbreak?
Mm-hmm. So a couple of things. One of the things that we've heard from caregivers throughout the pandemic is that there have been different experiences with interpretation of directions, interpretation of different implementation processes in different homes across the province. So I would look to what the guidance and direction is on the particular issues related to that home, outbreak constraints, etc. And I don't want to speak to the specifics of that because it's not my area of expertise to speak on a particular incident. But what I would say is it's always good to clarify how the directions align with what is being practically implemented, because we've seen a diversity of implementation. The other thing is, I think we do need to look at other tools and mechanisms for creating connection. And I know there's another session that's actually going simultaneous to this one around using technology. That has its own challenges. I'm a caregiver for my dad, who's in his 80s, who continues to live independently. And using technology to communicate with him has been a blessing and a very significant challenge. So I think we have to honor that different solutions may require different levels of support for people, and that it isn't just about having a physical tool that someone can use. It also may require support. I think now we also need, I was really glad that questions came up this morning about other forms of visits and planning for things like outdoor visits and other ways that we can engage safely if there aren't opportunities to engage in ways that other homes are able to right now, or ways that we have in the past. But I also think we need to look at what are the sustainable solutions. Part of what I've been grappling with, and many others have too, is okay, we wanted to get to vaccination, and then we got through vaccination, and now we're trying to get through vaccination within the public. And if we are to sustain ourselves through COVID-19, we also need to do so recognizing the present and immediate needs of residents and caregivers now. And so I go back to communication. I go back to communication with the homes. I go back to communication with government. I go back to let's work together to co-create the solutions. So that isn't perhaps a great answer for the person who wants a specific answer to their individual question, and I acknowledge that. But I do think we need to actually have the conversations that say, what are the workable solutions? What can we implement now? Like, let's do immediate, midterm, and long-term. Because we want to make sure we're moving in that direction, and not everything has to wait. Some things really could be short term and always done in the way that's safe and manageable for everybody involved.
I think that's really great feedback, especially I know our team, sometimes when there are specific questions, I agree it's hard to respond to things that are specifically to do with the home, but I'm glad you shared that feedback. And yes, we need to, have a call to action and look at the steps that we are able to achieve, at least in the short term as well. I got a great question. Especially, I'm really excited that it's from my coworker, Kathleen. One thing I will say to all of the attendees, a lot of us working at FCO, we're connected to a caregiver, or we have someone in a long-term care home. So I'm glad that we're able to also hear from the presenters and talk about new ways for even our own staff to look at how to do things. So Kathleen has asked, is OCO limited to supporting individuals who care for someone in Ontario? Her mother lives in Ontario, but she's a caregiver to her great aunt that lives in Michigan.
Well, we are supporting Ontario's caregivers, and the intention is that we're supporting people who are caring for someone in the province, but our resources are on our website, free and available for people to go and check out. So it may be that some of the information isn't applicable in a different jurisdiction. That's a possibility, but we really focus on those universal tools and supports that are of benefit to caregivers. So I would say go and take a look at what's there and see if it helps. We do receive inquiries from mostly caregivers from other parts of the country. We only have caregiver organizations in BC, Alberta, Ontario, and Nova Scotia. So, we'll definitely get inquiries from places where they don't have a caregiver organization, and we'll do our best to refer to other supports that are available, but hopefully the free resources on our website are a good place to start.
Okay, perfect. And I actually have another question for you, Amy. Is there anything that you have learned as a caregiver personally that you use in your everyday work?
Yeah. Well, I feel I'm going to steal Moira's line. I could talk for like another hour just about that. So I'll say this. I have been a caregiver, as I mentioned, 3 times in my life. One was for my brother who had cerebral palsy. One was for my mom during her cancer and palliative care journey. And now for my dad, who turns 84 in May, which is an exciting milestone. And they've been very, very different caregiving experiences at each of those times in my life. And I really was in a different time in my life in each of those experiences. So even though I didn't know it, I was a young caregiver when I was caring for my brother, and that's given me a great perspective on young caregivers. There are 500,000 young caregivers between the ages of 15 and 25 in the province of Ontario. That's a significant amount of people whose futures, their education, and their employment are being impacted by their caregiving commitment. So I have a personal affinity for young caregivers for sure. But I would say the biggest thing that I learned because of how unique my 3 caregiving experiences have been is that I never make an assumption that I know what your caregiving experience is like, because everybody's caregiving experience is unique to a person. Now, there are things that we have galvanized around, particularly with the pandemic, and there can be common themes, common issues that people face. So we do want to look at what are those trends and what are those themes so that we can address them. But at an individual level, I think it's really important to recognize I don't know what it's like to be in your circumstances, right? I can never understand, because it ties not only into the unique experience of the person you're caring for and you as a caregiver, but everything else you bring to the table as a person. And so I always try to recognize that uniqueness of each caregiver. And then I think the other thing is that because of my own experiences, I know what a difference support makes. And I'm very driven by wanting to provide supports that are actually going to have a meaningful impact in people's lives, right? I don't want to talk about it. I want to actually see it turn into something. So, hopefully we'll start to see some of the impact of that on Spotlight as we see some changes in the trends about caregiver experience. But one thing I didn't expect in the last couple of years was that a pandemic would really come in and change the whole course of things. And so, I have some real concerns about caregivers as we go forward and how we can make sure that they're supported and that they're successful in that caregiving role, because we're going to need caregivers. We continue to need caregivers, and they've got to have the support that they need to continue to do it.
Thank you for sharing a bit more about your personal life as a caregiver, Amy. I think that it really speaks to the passion that you have in your role for OCO as well. We did receive a great question, and I think it's a great way to kind of wrap up the session. In terms of best practices for family caregivers, family councils, we've heard quite a bit about families having an issue, maybe partnering or collaborating with home staff or their administration to get things done. So this question is related to, the family council or caregivers making requests, and, regardless of it is they're getting a lot of pushback and they're not engaging in discussion with those caregivers. Do you have any tips about how, they can achieve that mutual respect and kind of be the care partners that you spoke about?
Yeah. So I think I have to start by acknowledging that this is a challenge that we've been hearing about from caregivers throughout the pandemic. So, sometimes it's easier to kind of minimize the problem, and I don't want to do that. I really want to acknowledge that this is a challenge that people have faced to start. Then I think we have to come back to some of those tried and true communication strategies. And I did say earlier, communication is really key here. What's the common ground, right? What's the common ground between caregivers and the staff in the home? There are common goals, right? There are common stressors potentially, but what's the place of common ground that can be built out from, right? And then how can the family councils be used to bring common voice to caregivers, right? Because if we say, okay, it's easier, I think, in a way, to have one issue or one comment or one communication set aside. But if it is through the power of a group like a family council to say, this is a trend broadly within the home, or this is a trend broadly with caregivers, and I really believe, I always say, I don't want to bring a point of criticism in any conversation that I'm having if I'm not either willing to put forward a solution or be part of a solution. So I think saying, and again, I'm not in any way implying that this isn't happening, but I do think this is a fundamental part of the next step, is to say, here's some proposed solutions, or, we get that there may be real constraints here. We want to be at the table to be a part of the solution, right? And, we've got some great examples of participants through our Partners in Care pandemic initiative of long-term care homes who are using that toolkit to great effect. So the other final thing that I might say about that is, if sometimes people need that peer-to-peer connection, and we would be happy to facilitate those connections with homes who are implementing the toolkit, so that staff from the homes could talk to other people who are implementing and have them understand how it's being effective, why they like it, what's working, what's not, right? And have a little bit of that peer-to-peer support. So that's another potential creative solution that we could bring to the scenario that might help.
Those are some really great tips. I know it's something that might continue to happen, but I'm glad that you emphasize the common ground. And I think everyone has a stake in the home. And, at the core, it's really for the residents. We want to make sure they're living vibrantly and aging in place, and, living in a home that they enjoy and feel comfortable in. So thank you for those great tips. I can't believe we've already come to the end of the session. Amy, it's always a pleasure talking with you, and now having you as a presenter. And thank you for, providing us with some insights on best practices, especially actionable steps for moving forward. If everyone can see on their screen, Amy's contact information is there, as well as the website and email for the Ontario Caregiver Organization. So please do connect with her and her team to get some more insights, as well as to access their resources. So now we are going to move into our lunch break. So I hope everyone can grab a cup of coffee, a sandwich, and be back to join us for our panel session that will be starting at 1:30. So thank you guys so much, and we'll see you soon. Thanks again, Amy.
Thanks, Tiffany. Thanks, everybody.
Take care.